All right.
Live?
We're live.
Paging Dr. Friedman, room 44576. I always wanted to do that.
Well, does that make you feel better now you got that
I honestly
off your
do.
chest?
I feel good. I always wanted to page the doctor.
Now you got him.
A lot of people like hate on a day to the doctor or don't like a day to the doctor. I actually don't mind it. You're in the waiting room, you got like good music, magazine selection.
Oh yeah, we got Boys Life, Golf Digest, it's all good stuff. Yeah.
What are you doing with like somebody like me who's in like your waiting room and waiting on the doctor, and I'm taking all those long ass Q-tips. I take like 5 because I can't find those long ass Q-tips. I'm just in there like playing around. Like,
wait, is that why my inventory's off? Holy smokes! I'm gonna have to start checking tongue depressors now.
Been practicing for?
Been in practice for 32 years.
Wow.
Yeah,
it's incredible.
Long time. Yeah.
Was to me like getting a doctorate degree seems like one of the hardest things that you can possibly do.
It is hard, man. It's a lot of work. It's 4 years of college. Usually you're a science major. I was a biology major, and then 4 years of medical school, and the first 2 years are just grueling. It's a lot of studying. I remember my very first day in medical school, my very first class was biochemistry. And normally you think like when you go like through college and go to lectures that, you know, you kind of have a sense of what's going on. And then that first lecture, I walked out of there, I was going, blah, 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 blah. I had no idea what the professor was talking about. So hit the books at night.
That's the first day?
That's the very first day of medical school. Right. And then it doesn't get any easier from that. Sophomore year, we were getting like 80 pages of notes a day.
80 pages of notes a day?
80 pages of notes a day.
So that's just hours on end of study?
Right. Yeah. And, you know, it's budgeting your time. I mean, yeah, you can find some time for play, too, and you have to do that. But yeah, it's a lot of focus, a lot of discipline, sort of like what you have to do here at the gym if you want to be, you know, successful. But it's a lot of work. It's probably the hardest thing I've done, other than internship. That was hard too.
What was internship like?
Internship was a lot of abuse, a lot of long hours, 36-hour shifts, a lot of studying, a lot of work, a lot of what we used to call scut work, where you were the low man on the totem pole and had just had to do things that other doctors wouldn't do, but you had to do that. But it was a great learning experience for me. I interned out in Michigan, and they were very hands-on out there, so I got a lot of experience in doing a lot of different things.
Is that the way is the process still the same now, or?
It's different now because the 36 hours of...
It just seems brutal.
Yeah, it's brutal, and you know that at the end of that 36 hours, you can't make informed and proper decisions, especially when it comes to people and their health and their lives.
Right, and how much of that information are you actually processing?
Exactly. You know? So nowadays, they pretty much got away with that as far as your training. It was kind of like a rite of passage back in the day, but it's gotten away from that now. So it's not as grueling, but it's still tough. It's still challenging. You have to really want it.
Well, one of the things I like most about you is you continue your education.
Correct, and that's what you have to do. Like for me to maintain my board certification, I have to do 150 hours of continuing education every 3 years. So sometimes I get it all in one lump if I go to a conference or something like that. But you have to stay up to speed. I can tell you, for example, 90% of the medicines that I prescribe today were not even available when I graduated from medical school.
90% of the medicines that you studied
that I prescribe today
are no longer available.
Well, they're available, but
right.
Some of them are available, some of them are not, but we don't even use them anymore because they're far better, superior medicines.
I think as a whole, there's a big disconnect, you know, taking that point that you're making and that scenario. There's a big disconnect, especially in the strength and conditioning field in conjunction with the medical field. You know, I think that there's a lot of whether doctors are unsure of what we're doing, you know, trainers that know what they're doing in the field of strength and conditioning.
Right.
And then there's a lot of trainers that aren't working with doctors in the field where doctors know what they're doing.
Right.
And so now there's a huge disconnect between the two.
Right.
And there's a lot of outdated information. And I think that it comes down to the fact that some people just, quite frankly, they're not reading. And they're not staying up to date with the latest and greatest information. And they're not on board with what's modern day, what's working, what's not working.
Right.
You know what I mean?
Right.
If you think about, like, you know, I know a lot of doctors that will tell people not to squat. You know what I mean? And I think a relative, you know, a statement that relative, and that blanket of a statement. I mean, we squat every day to go to the bathroom.
Right.
And which way did you squat? You know, how deep did you go? Did you put a bar on your back? Did you put a bar in the front of your body? Did you put a bar, you know, a dumbbell on your right or left side? Was there a band below your knees to keep your knees out from flaring in? Do your knees glide forward? Do you have the ankle mobility to squat? Do you elevate on a heel lift? So these are the kind of the precautions and the regressions and progressions that we're using in the world, you know, in my field, that we're using for strength and conditioning. And if you don't know that from a medical stance, if you don't know what we're doing, you know, a lot of people, a lot of doctors will say, well, you have back pain, so no gym this week.
Right.
But if you come to me, I'm going to foam roll the hell out of your hip and get all those knots out. I'm going to be able to stretch your hamstrings, start working on your core and finding the problems. You know, another example is one of my athletes has a hand injury. And he actually has to lose like 8 more pounds than I want him at for his team.
So why isn't he squatting?
Exactly. And his doctor told him no gym for 2 weeks. So that's 2 weeks, 14 days of no calories out, you know, versus calories in. With we can't work his legs, like you said. We can't develop his core.
Right. So what has to happen is you have to take that disconnect and take that away and start integrating physical training, exercise, physical therapy, lots of things need to be integrated in medicine to really make it successful. That's where things are going, but it's going to take a while to get there, because you're right, a lot of doctors don't know what it's like to train. They assume that training is just lifting weights and trying to get like Arnold Schwarzenegger, and it's really not. If they come to this gym, they're going to see what really it's all about. It's complete, and that's what I love about you. It's because you do everything in progressions, and you know exactly what each client needs to have done and progress them gradually. No one gets hurt in this gym. No one gets hurt. And that's that. And if they did, they'd have a better sense of where they can help patients with back pain rather than give them anti-inflammatories. And nowadays, the big push is to get away from narcotics and things like that. If people exercised more and did it correctly, like what's wrong with doing squats as long as you do them correctly, right? So, and that's, I think, where medicine is going. It's being integrated in other areas like diabetes, getting like patients to go see a nutritionalist right away, someone that's actually inside the office and not having to go 5 miles away to go see a nutritionalist. So one day maybe that'll happen with exercise, and it's starting, and hopefully that disconnect becomes integration, and that's what we really need.
For sure, and I'm definitely seeing that, and we're definitely starting to get away from just kind of putting you know, a duct tape on the roof if there's a leak in the roof. Right. You know what I mean? You have to actually get in there and fix the actual problem.
Exactly.
You know?
Exactly.
And you've told me before that, you know, if you give someone some medicine, of course that's not going to fix, you know, the problem in its whole sense, especially when we go back to talking about back pain. You know what I mean? If you're just doing an acute fix and the quick term fix, how is that going to strengthen up your core? How is that going to work, you know, the glutes, which are probably the problem, your hip flexors being really tight, which is part of the issue, you know?
Absolutely. I mean, it's all got to, you can't have a short-term fix. There has to be a long-term plan. And the problem is that some doctors are so busy, they don't have the time to find that long-term plan. And that's why it's going to be important to get exercise people involved, because I think a lot of things can be fixed with exercise, but people have to be willing to want to do it.
For
That's
sure.
the thing. And when you're not used to doing it, it's hard to teach an old dog new tricks. But you still got to try. You still got to make that effort.
And that's the issue with the holistic approach. You know, it's hard work, and it's discipline, and it's sacrifice.
Exactly.
You know?
Exactly.
What do you think, like, some of the healthiest things? So if we were to say, okay, like, Doc, what's 3 or 4 things that someone could do to be overall healthy, optimal health?
Okay. So number 1 is not smoke. Smoking cigarettes is absolutely the worst thing that you can do. So not smoking is number 1. Number 2 is your healthy lifestyle. Exercise. You should exercise regularly. As humans, we're supposed to exercise. We're not just supposed to sit at a desk and look at a computer all day long. So make it part of your life to go exercise regularly and be consistent about it. Whatever you do, moving is better than not moving, right? You always tell me that. So whatever floats your boat, whatever you like, just make it fun and do that. Eating healthy is really important. Eating clean, we always talk about that. I try to tell my patients, shop the perimeter of the supermarkets. If you think about it, all supermarkets are set up the same way. All the healthy stuff's on the outside, all the junk's in the middle. So shop the outside, stay away from the middle, and if it comes in a box or can, don't eat it. And then the last thing I think is BMI, maintaining a healthy body mass index. Now, Body mass index is essentially a measure of obesity, right? But it's what's healthy for you, because like you were saying, like a professional football player could have a BMI of 32, but he's rock solid.
Right.
You know, that's a healthy BMI for him. So the idea is maintaining a healthy body weight, whatever that happens to be. Annually,
so consistently,
not like the up and down, right? Not the yo-yo, right? That's where you run into problems. It's starting to yo-yo. You drop 10 pounds, you put back 15 more.
Have you guys found any research where if you do yo-yo, where you're starving now and you're losing weight on the scale, and you're not factoring in BMI, which is bone density and water weight and muscle mass, and this is 5 pounds of fat and this is 5 pounds of muscle. They weigh exactly the same, but this one looks totally different. You're not factoring those things in, and now you're only worried about the number on the scale, so you're always yo-yoing throughout the year. Have you guys found any physiological problems in metabolism? Or?
Sure. I mean, it can lead to diabetes. Start yo-yoing. It's hard to lose that weight, and then obesity just leads to so many other problems. Heart disease, diabetes. So it's really important to try to be consistent, and that's the trick, and that's the hard part. Is being consistent. And we talk about, like I talk with my patients, you talk all the time about, I tell my patients, you're supposed to eat 3 times a day, so that's 21 meals a week. You're allowed to cheat on 2 of them.
Right.
But 19, you have to be good.
Right.
And if you can do that, so that way when you do cheat, at least you're not depriving yourself all the time. And that's, I think, where people run into trouble, because they're so strict on a diet. They can't have ice cream, they can't have pizza, they can't boo, 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 boo. And they lose all this weight, and all of a sudden they say, screw it, I'm going to eat pizza, I'm going to eat ice cream, and now their weight's back up again.
Right.
It's better that you don't deprive yourself, and maybe just have those 2 cheat meals, not cheat days, but those 2 cheat meals. That way it will help you in the long run be more consistent and maintain that more healthy body weight, that more healthy BMI.
The moderation rather than deprivation.
Correct.
Because deprivation isn't going to be a long-term success.
Right.
What would you say, if we're staying on nutrition, what would you say the worst things you could eat are?
Anything that's really fatty, like fast food. I mean, I don't think I've been to McDonald's in 10 years. But yeah, fast food, no one should be supporting McDonald's or Burger King. But anything that's really fatty is going to be, ultimately bad for you. So,
do you think that eating primarily leads to heart attacks? What do you think are some of the most unhealthy things people do if we just did the most healthy things people can do?
Heart disease, I mean, is a genetic disease. So if you have a family history of heart disease, you're at risk. If you smoke, you're at risk. If you're overweight, you're at risk. If you're diabetic, you're at risk. If you have hypertension, you're at risk. So other than your genetic history, all the other risk factors are modifiable.
This is really important, though, family history. I don't think a lot of people have a strong understanding or maybe even know about their family history.
And I would agree. And there's services out there like the 23andMe and Ancestry where you can start to learn a little bit more about your family history, but that's very important. It's really an important part of when a patient comes to see me for the first time, we take a family history to get a sense of where they are. Because if your dad had his first heart attack when he's 45, you're going to be at risk for a heart attack. So you need to start looking at things that you can modify. So if you smoke, stop smoking. If your blood pressure is high, talk to your doctor, lose weight, exercise, cut out the salt in your diet, get your blood pressure under control. If you need medicine, fine, but get your blood pressure under control. So there's definitely things that you can do to help reduce your risk. You're not going to completely eliminate it, but at least reduce your risk to have.
Do your part.
Right.
And if we're really thinking about what we're talking about here, I mean, these are basic steps, and these are things that you are in control of.
Correct.
So if we can do the things that we're in control of, that puts us in a lot better position. Those are the things that we should be doing, 90% of the time, like you say, anyway. Primarily resistance training. If we're just talking about resistance training, did you see that study where they found in resistance training, it's actually increasing the neurological capacity of your brain cells. So just building bone density and resistance training is actually making your brain bigger.
Right.
Is that
not only bigger,
but
it's actually helping to form new connections in your brain, which is so important in Alzheimer's disease, Parkinson's disease. I mean, there was a small study you may have seen on 60 Minutes a year or two ago with Leslie Stahl with her husband. He was a Parkinson's patient, and they did boxing. And all the people who did boxing with their Parkinson's disease, they stayed the same or they got a little better. None of them actually regressed.
Wow.
And so exercise, also there's studies that show in Alzheimer's disease, exercise is so important. You got to exercise your body to exercise your mind. And what happens is, yeah, it's more blood flow to your brain. It allows your brain to make new connections, those neurons starting to connect. And that's very, very important in memory. And it's important in motor function. So yes, exercise is very important, in my opinion, in neurological diseases, can really make a difference. So when I have patients and I see patients all the time concerned about Alzheimer's, and I have personal experience because my mom had Alzheimer's, exercise is at the top of the list. What I tell patients, if you want to try to help your memory, you got to exercise.
And one thing you're always stressing to me is about resistance training primarily is the bone density growth that you see in your females.
Right, absolutely. It's very important. As women get older, you go through menopause, you lose estrogen. Estrogen is a major driving force to drive calcium into the bones. So the bones start to break down faster than they're being built up. That leads to osteoporosis. And the problem with osteoporosis, and I'm sure you see the little old ladies with the hunchback in Notre Dame, they're osteoporotic. The problem is you're at much higher risk for fractures. So now you start fracturing, you break a hip, you got to have surgery to fix the hip, you're at risk for infection and bleeding and post-operative complications, or you break your back, now you have chronic spinal pain, very difficult to treat. Once again, preventable. One of the most important thing, in my opinion, exercise. For osteoporosis, you got to make sure you're getting calcium and vitamin D, get some sunshine, make sure you're getting calcium, get it naturally, drink milk, eat cottage cheese, eat yogurt, do it the right way, but get the exercise and get some sunshine. And that's really what helps to keep bone density where it's supposed to be and help reduce risk for fracturing. Yes, there are medications, but medicines, they have advantages and disadvantages. It's always better to try to do things naturally.
Yeah, for sure.
Yeah.
And speaking of age, like if you're not the primary example of age just being a number, dude, I mean, you're what?
This year.
Dude, there's no way, like, that when you go to Colorado, there was 0% chance I'd be able to hang with you out there in Colorado. Brad's sending me messages on my phone at like 6:30 in the morning, just got done at the hotel gym there, and there's dumbbells everywhere. He's looking like a savage. And then at 8 a.m. he's skiing. By 10 you're doing golf, then you're doing lunch, then you're at a concert at this, what is the name of that?
Red Rocks.
Yeah, so you're actually in the concerts surrounded by the
mountains.
Right, at the top of the mountain.
Yeah,
it's very cool. But dude, honestly, I mean, age is a number to me. And I was wondering your thoughts on this. Of course that's my opinion, but I deal with a lot of humans a day at all ages, all, different skills, of all different walks of life. But in my opinion, I think that if you do the things you're talking about, and control what you can control and exercise and put the right stuff into your body, right? What I see is energy levels and cognitive skills like really high on most people. It doesn't matter your age, because I have plenty of, I know plenty of young people, high school, young 30s, whatever. If you're stuffing pizza in your face and, just sitting in front of the TV and not educating yourself and not, increasing your movement, being active and doing resistance training and, finding ways to better your life. I find that their activity level is very low and their energy levels, are very low. You know what I mean?
Absolutely.
And so you would think it doesn't matter what age you are, if you're looking at just the actual human. If you're looking at the activity level of the human, the positivity of the human, the way in which the mind works of the human, the person along the lines of the way in which that you live your life, to me that's young. It's either young or old or whatever, or however you want to put it, through the way in which that you live your life, not a number.
I agree 100%. I think right now I'm probably in the best shape of my life. I mean, I'm doing 5K runs, which I never did. Spartan races, things like that. I come here a couple times a week. It really makes a difference. And you're right, age is really a number. And there's no reason as you get older that you can't really get better. Skiing, I think I ski better now than I ever have in my life. I ski more difficult terrain. I can ski harder, on the chairlift going up, that's when I recover. But I can keep up with my friends. I have some friends that are excellent skiers. And now I feel like I'm at a point where I never used to be able to keep up with those guys. And now I can. And it's a good feeling because you get to do some things. They say, "Wow, you look up and go, I just skied that."
And you're preventing injury, and you're being able to stay out there all day the way that you are, the way you were telling me. How high up are you? 14,000?
Depends on where you are. Like Breckenridge is almost 13,000 at the top. The air gets kind of thin. So, you know, one of the things that it's important if you're going to ski at that altitude is that you have to be prepared for it. You have to hydrate. It's got to be different, right? Yeah, you have to hydrate. I mean, there are medicines like there's a medicine called Diamox, which actually is used in treating glaucoma. It's an old-fashioned medicine, but what it does is it allows the hemoglobin, which is the oxygen-carrying molecule inside our red blood cells, to hold on to oxygen a little bit longer.
Wow.
And that helps with altitude sickness. But so what we normally do is, like when I go on my big ski trip, we go out a day in advance, and we don't ski that first day. All we do is we hydrate, we get used to the climate, get used to the altitude, and then that first day we ski hard.
Do you feel like it actually increases your lung capacity? Do you believe in that, all that altitude training?
I think it probably can over time, but I'm not out there. You know, when you're only out there for a week, it probably does not. If you live out there for your entire life, it probably does.
Right.
Yeah.
I think it would be cool to mention some tips along the lines of what we do actually in here for skiing. And combat that with actually, you know, you were talking about as we age, you know, the gravity starts to pull us down. So regardless of whether you're a skier or, you know, let's say like 40, 50 plus, you know, when you're in the gym, what should you do? Well, first off, every day should not be intense. You know, there should be a high intensity day, low intensity day, and not too many days too intense at all. Like we said, we want recovery days, so walking is going to be our friend, you know what I mean? Even like, you know, skiing is a little vigorous, but finding something that you like to do and doing that. But when you're in the actual gym, upper back development is very important. You know, as we begin to age, I think not grinding away at joints and certain ways in which that we put our shoulder. I like flexion, extension at the shoulder. So whether we're pressing dumbbells or pressing weights or we're pulling weights, you have to watch the way in which the shoulder moves. I don't love an abducted shoulder, which is where your elbow flares out, and especially over the head. I think most exercises like we do, like that's why we do a ton of the rowing, a ton of the TRXs, like we're always talking about, and holding upper body position, especially for skiing with all the, you know, left to right and capability of pro-tracking. The scapula, we want to pull it out. We do a lot of holding positions, TRX rows, dumbbell rows, but also hip development and core development. You know, and going back to the back pain with the doctor thing, I think the stronger we make the glutes, the more we activate, especially like the sides and stabilizers of the hips, and especially if we have desk jobs, you know, a lot of that stuff becomes dormant. So when we put like mini bands on the below your knees, and we start working on the sides of your hips as much as possible, and squatting and lunging, especially single leg stances. Right. Because single leg stances, whether you're skiing in an athletic sense or, you know, just an everyday desk worker, it fires up more muscles around those legs and stabilizers and strengtheners. And core stabilization. And core stabilization is extremely important. Right. You know, and just again, you know, developing the posterior chain as a whole. So getting the deep abdominals activated for postural purposes, working that upper back, developing the hips, developing the hamstrings, and getting some stability involved. If you can do those things, you're going to be more powerful in the slopes, you know, which is why we're always emphasizing it. And jumping, you know, explosiveness is important, but too much jumping can add, and too chaotic of a situation, and too much volume could actually lead to joint pain. But if you do those things, I mean, if you're a desk worker or you're on the slopes, you know, those things are going to improve you immensely, you know. From a doctor recommendation standpoint, let's end with this, right? The doc's recommendations. What are your recommendations to people? What are you telling people?
So, most important thing is go to the doctor. Get a physical exam every year, okay? That's the most important thing. I mean, how do you know your brakes are bad unless a mechanic pulls the tire and looks at them? So you have to go to the doctor. Don't be afraid to ask questions. And I would tell you, if the doctor doesn't want to answer your questions, find another doctor. Right. The doctor should be listening to you and answering your questions. And if he doesn't have the answers, he should go find the answers. So those are the important things. It's really important because especially nowadays, healthcare is evolving and changing so rapidly. So right now, Obamacare, Trump care, who knows, right? I don't know where it's going to be in 20 years. What I think it'll be in 20 years is going to be a lot more expensive than it is today. So I want people getting healthy now so that 20, 30 years from now, when you're older, you're not spending all your hard-earned money on medicines and treatments and things that you could have prevented by taking care of yourself now. So go see the doctor. Don't be afraid to ask questions. Don't smoke. And come to Finisher Fitness and work out.
Dude, thank you so much for doing this.
Thank you, brother.
I had a great time.
Appreciate it.
I'm honored to have you on.
Yeah,
thank you, brother.
Thank you.
Appreciate it.